Now, morphology of acute inflammation. We have different sort or different morphology for acute inflammation. The first type that we are going to discuss is serous inflammation. And serous inflammation is when there is a thin watery fluid that lacks fibrinogen and fibrin and can be seen in viral serositis, and also in skin inflammation, for example, when there is blister or burns. You can see here that the water accumulation and how the serous inflammation is watery and it lacks fibrin and fibrinogen. Now, another form of acute inflammation is catarrhal inflammation, and that happens in common cold, and this is when we have hypersecretion of mucus. So is inflammation of mucous membrane, and it happens mainly in our airways or cavities of the body. You can see the appearance, how it looks like. Okay, now fibrinous inflammation is another form of inflammation that can happen, that occurs when there is more extensive leakage of fluid and vasculature, and that causes the passage of large plasma proteins, especially fibrinogen, into the tissue. And you can see here myocardial infarct that has been that has led to uremic and post-myocardial pericarditis, and you can see the formation of these fibrinous inflammation on the tissue of the heart. And you can see how it looks like there is a very firm kind of appearance to it, and we have the fibrinous shape of this inflammation on the heart. Now, another one is hemorrhagic inflammation. And hemorrhagic inflammation when there is injury to the microvasculature, and that leads to bleeding and exudate of erythrocyte. So when there is high erythrocyte exudate, that's when we have hemorrhagic inflammation. Can be due to severe vascular injury, or when we have, for example, acute pancreatitis, or that it is also seen when we have meningococcygeal septicemia due to disseminated intravascular coagulation. Also, we can see the hemorrhagic inflammation. You can see in these two patients how it looks like. We have the PGA, formation of PGA, and also here you can see a photo of acute pancreatitis. Now, purulent inflammation is when there is large amount of pus. So purulent stands for pus formation, and that's when neutrophils, dead cells, and fluid all together form this pus. This can be seen when there is infections by pyogenic bacteria such as staphylococci, or also those kind of infections that can cause the pus formation. Now, membranous inflammation, it's sort of when our epithelium is coated by fibrin, and epithelial cells are inflamed. That can be seen in pharyngitis or laryngitis due to C. diphtheriae. You can see the photo here. And how you can differentiate membranous inflammation is you cannot separate this inflammation, or you cannot cut off. If you do that, that leads to bleeding of this part of the tissue. Another form of inflammation is pseudomembranous inflammation, and that's when we have superficial mucosal ulceration with overlying slough of disrupted mucosa. That leads to fibrin in mucous inflammatory cells presentation, and it can be seen in pseudomembranous colitis due to Clostridium difficile. Another form of inflammation, acute inflammation, is necrotizing inflammation. What you know is that when there is necrosis, after necrosis, there is a pooling of neutrophils, and there happens a acute inflammation in order to get rid of all of those debris. Now, high tissue pressure due to edema may progress to vascular occlusion and thrombosis, which leads to septic necrosis of organ. You can see here the appearance of acute appendicitis. You know that in acute inflammation we have edema, and that edema can cause ischemia because that's causing the occlusion of vasculature to the tissue, and that eventually can cause gangrenous appendicitis and bursting of appendix. Another way of representation of acute inflammation is fistula formation. What is fistula? Fistula is connection between two organs, and that happens mostly in those organs that have a lumen. Now, an example of that can be intracutaneous fistula. You can see that here. It happens to patients that are mostly obese or are sitting a lot. That's when the cutaneous forms a lumen and connect the rectum to the cutaneous part of the skin. Now that leads to formation of pus and inflammation. Another one is seen in patients that are pregnant or elongated pregnant, and that leads to formation of fistula in these areas that are seen in this slide.